Welcome back to America's Retirement Headquarters, the home of the Retirement Guys formula and America's Medicare Associates with Nolan Baker, Scott Kerschner, and Jeremy Baker. 419-794-3030 is the phone number. The website, arhq.com. If you want more information about upcoming events that they've got that they're offering throughout the area, you can go to the events tab of arhq.com. If you want to find out more, listen to previous editions of the show. Perhaps you missed the first half of the show, or you just want to know more, hear previous editions available on Spotify, Apple Podcasts, YouTube, wherever you consume your media. Just search for America's Retirement Headquarters. It's all there for you to check out at your leisure. Now, perhaps someone wants to. They have the means to retire early, before the age of 65. There's a lot of things that you want to do. You want to make sure, as we say so often here, all your T's are crossed, all your I's are dotted. Healthcare is obviously going to be an issue. Medicare not being available until after you hit 65. So if somebody wants to retire early, they're no longer going to have an employer-sponsored plan, and they're not going to be eligible for Medicare. What can they do? What are the things they can look at as far as insurance before 65?
Well, I'd say this is one of the areas that I love working with you, Scott. I think this is an area where all of these things kind of overlap each other, and I think that's one of the things that we do so well here at America's Retirement Headquarters is bringing that health insurance planning together with your overall financial planning. It's part of the retirement team action plan. It's something that we can provide for you as a listener. So if you're over the age of 59 and you're looking to retire before the age of 65, you really want to have this game plan mapped out before you move into retirement time, because there is absolutely strategies that we can implement to help you try to minimize what your overall cost structure is on the Affordable Health Care Act. And if we look at it, what's interesting is the affordable healthcare. So the healthcare.gov website is a household income, not an asset test.
Correct.
Meaning that the amount of reportable income is going to determine if you're entitled to receive some type of credit. We had helped a couple here recently where she was age 65, he was age 62, getting ready to retire, and they came in to see us about a year before retirement time. And he was going to need to get on the Affordable Care Act for those 3 years to cover his health insurance cost. His initial plan prior to coming in to see us was just to kick on Social Security, start taking income, and draw money out of his 401k. Common sense, right? That would make sense on what he was planning on doing. The thing that he didn't realize is that drawing Social Security as well as drawing money from the 401k, that's going to be considered 100% countable income for what his health insurance premium is going to be, meaning that the cost was going to dramatically increase with what those expenses are under that strategy.
Correct.
Before he retired, what we did is we helped create a bucket of money that was already paid taxes on, showed him where to draw money from an after-tax account and or a tax-free account. And by doing that, we were able to keep his income where he was able to get some credits to keep his health insurance costs much more affordable for those couple of years. And there's kind of a fine line that you have to go, because if your income goes too low, you end up falling into what's called Medicaid status. So it is kind of an area where we love working together for health insurance and navigating that landscape and putting it all together.
Yeah, you're absolutely right, Nolan, and I love doing this. These are things that are fun to both you and I because of the way we get into the numbers with people and things like that. But it's crucial to understand what's reportable income, and it's crucial to make sure that you use the right numbers. I will tell you this: if anybody out there listening, if you want to sign up for the marketplace, you're more than welcome to do so on your own. You can create your account. If you contact the marketplace once you have questions, because I guarantee you will have questions when you go on healthcare.gov and try to do this on your own. When you talk to someone at healthcare.gov and ask them to help you in navigating through signing up for an account, they will ask you simple questions and they will put in the information that you give them, and they will spit out a number and say, this is what you will pay, this is what your subsidy is based on what you've told me, and that's it. One of the advantages to working with myself at America's Medicare Associates is I will go through the scenarios with you and work with you on a one-to-one, face-to-face, person-to-person discussion. I will explain what happens if you estimate, because these numbers are truly estimated numbers. You know, I had someone just the other day ask me, so what happens if this number's not right? I says, well, look right here. It says estimated income. That doesn't mean that you're going to hit that exactly on the penny, but it's an estimate. And one of the things that I do is I take the time, I sit down, and I go through with you exactly what happens at the end of the year when you file your taxes based on your 1095 form you're going to get. I explain to you how the subsidies work, if you overestimate, if you underestimate, how that's going to impact you. So healthcare.gov and the people that work there do a fine job, but they're not going to drill down in your specific situation and your needs. So if you are looking to retire before 65, or you have a spouse that will, you're carrying the primary coverage on and you retire and he or she loses their benefits, you're going to need to sign up for the marketplace. We can help you with that. Nolan, you and your team, and you working very closely with myself and my team, we can put a game plan together and say, okay, let's get your reportable income at this level, and this is how it's going to be impacted moving forward, and how your benefits are going to come into play.
Yeah, absolutely. So again, if you're within 5 years of retirement, you know that you're going to retire before the age 65. The key to this is planning ahead. So you want to call us if you just retired and it's already happened, then get a hold of us. But where we can optimize the strategy for your family is if you call us. And if we have to move some money around, we want to do it before you're on the affordable health care, because if you do it in that year, it's going to be countable that year.
Right.
And as you pointed out, Scott, you're going to put your estimate in there, but when you file your taxes, if your estimate was wrong and you spent more money, they're going to take that credit back.
Absolutely.
And so you could get a substantial tax bill as well. So we're here to help you. And again, if you're looking to get health insurance before the age 65, let's talk.
All you need to do to get started to reach out to the team at the Retirement Guys Formula and America's Medicare Associates, simple phone call, 419-794-3030, or if it's more convenient for you, you can go to the website, and that is arhq.com.